All right, so Levophed. So Levophed functions as a peripheral vasoconstrictor. Well, it falls under the vasopressor category. It's an alpha adrenergic action and also a beta adrenergic action. So you got to think it activates on the alpha adrenergic, causing vasoconstriction, and it also is an inotropic stimulator, meaning it increases the force and contractility of the heart through the beta adrenergic actions also, beta 1. And it also does cause some dilatory of the coronary arteries. That's why it does work well if you got hypotension in an MI patient, because we also have some dilation of the coronary arteries. Indications for Levophed is profound hypotension in patients that are not hypovolemic. Key thing to remember there is not hypovolemic, meaning if the patient is volume deficit, also known as volume down, then the volume should be replaced before attempting to increase the blood pressure by pharmacological means. So you want to give this patient fluids. If that doesn't work, then we can start tightening the vessels down. So let's fill the pipes, then let's tighten the vessels. The dosages vary. You're going to see common dosages out there anywhere from 2 to 10 to 10 to 20. New common dose is 10 to 30 micrograms a minute. You're also going to see some out there that are weight-based, but we're staying away from those right now. All right, how to make a Levophed infusion. Excuse me. So the first thing you want to do is gather all your equipment. You want to make sure you got a syringe, draw your medicine up. Obviously the medicine, this is Levophed. This is your common mixture for Levophed, 4 milligrams and 4 milliliters. It's either going to come in a vial like this, or it might come in an ampule, glass ampule, but usually it's still a 4 milligrams and 4 milliliters for a milligram a milliliter concentration. And then you want something to mix it in. The standard mix is a 250 bag. Usually it's not a D10 as you see here, but this is all we had available at the moment, so that's what I'm using. Usually you want to mix it in a D5 or a normal saline. Most of your EMS agencies have the normal saline 250, and that's perfectly okay to mix it with. So step one, since we know we have 4 milliliters, first thing we want to do is draw out 4 milliliters of saline from our bag.
Now let's put it in.
Yeah. And then you're gonna pour your medication from your vial. And you're gonna inject the medication into your bag. Give your bag a mix. And now you have a Levophed infusion. So if you'll notice, we took 4 milligrams and now we mixed it in 250 milliliters. So our new concentration now is 4 milligrams in 250 instead of 4 milligrams in 4 milliliters. So this is no longer a factor. 4 milligrams in 250 milliliters. Now, Levophed is dosed in micrograms. So now that's the same as saying 4,000 micrograms in 250 milliliters, which gives you a concentration of 16 micrograms per milliliter.